right. So Medicare Advantage. So that's an option people hear a lot about. So how does a Medicare Advantage plan work, and how does it compare to the traditional Medicare?
Well, a Medicare Advantage plan is really similar to what most people are used to having as far as their health insurance coverage. So most people who've worked for an employer and had their coverage through there, or if they've been on the healthcare.gov plans through the government, they've probably been on either a PPO or an HMO type plan. Okay. That's what the Medicare Advantage plans are. So, and you would have an option. You could choose whether somebody wants an HMO or a PPO. There's many carriers that offer these, and each one has many options. So there's literally in one zip code, somebody might have well over 100 plans to choose from. So there's lots of options. And once again, as I mentioned earlier, that's kind of where I come in, trying to find the best plan that fits. So you've got your Medicare Advantage is going to be your PPO or an HMO type plan. They're going to have networks. So one of the things that's important is somebody who's looking at a Medicare Advantage plan is that we find out who their doctors are. Are there doctors in the network? Are there hospitals that are important? Is the hospital in the network? We look at those things. One of the really nice things about the Medicare Advantage plan is they're complete. We talked earlier about a Medicare supplement plan does not include medications. Medicare Advantage plans do. Medicare Advantage plans included. So you would have your hospital, your doctor, all of your prescriptions, and they even have additional things such as hearing aids benefits, vision benefits, fitness benefits, dental benefits. So it's more of a comprehensive plan. It's similar to what people I think are used to that they've had over the last, 20, 30 years maybe. So there's a comfort level there. I'm a big fan of them. I like them a lot, but I also like Medicare supplements a lot too. And it's not really what I like, it's what the client likes and what makes the most sense for them. And that's why I end up having long conversations, because I have to find out what it is they're looking for, what's important. And then we have to match up the right plan with it. Another big advantage of the Medicare Advantage plan, the advantage of the Medicare Advantage is there's no premium. If you own a Medicare Advantage plan, well, I don't want to say no, 99% of the time there's no premium. There's always an exception to every rule, but basically your Medicare Advantage plans here in the Gulf Coast area, there's not a premium involved. So you, for example, could enroll in a PPO plan and there's no premium. You're paying your copays, etc. Remember this, everyone has to be enrolled in Medicare Parts A and B to be on a Medicare Advantage plan. So they're still paying that $185 to the government, okay, each month for Part B Medicare. But the Medicare Advantage plan itself does not have a cost to it. All right. So that's a big advantage, whereas a Medicare supplement plan would. Medicare supplement would have the price of the Medicare supplement itself. Plus, you'd also have to have that Part D plan on a Medicare supplement. So costs are a big advantage with Medicare Advantage plans. There's lots of options within Medicare Advantage plans. There's things that are called Part B givebacks. Okay. We've talked about the $185 premium you're paying to Medicare for your Part B. Well, some of these plans will pay some or almost all of that Part B premium for you. There's a local PPO plan that pays all of that $185 for you, with the exception of like $10.30. So Medicare Advantage plans can be extremely affordable situations. Some Medicare Advantage plans, there's also plans called dual special needs plans. A dual special needs plan is for someone who's on both Medicare and Medicaid. So that's the dual part of it. So there are plans out there, a Medicare Advantage for people who are on both Medicare and Medicaid, where they not only would not have to pay a premium, it would pay their Medicare Part B for them, and can send them some money towards things like groceries, utilities, or rent. Those are the commercials you see all the time that Joe Namath gives. You might be eligible for, money in your pocket and free this and this and this. And woo-hoo. You know what? What they don't tell you is, in order to be on a dual special needs plan and get those benefits, you have to also be on Medicaid. Okay. But that Part B give back I talked about a minute ago, that's for anybody. I've had people that money's a real issue. We've put them on the Medicare, and it's a PPO plan with a Part B give back. Literally, they have $10.30 come out of their pocket every month, and they have full medical, full doctor benefits. They have prescriptions, fitness, hearing, dental, vision, all those things, and they're paying $10.30, literally. There's so many options with Medicare, all the way from, paying that little to, Medicare supplements, where somebody might be in the ballpark of, $400, $450 a month. So Medicare Advantage, they do have, one of the things in the past is that people have asked, what about travel or that type of thing? If somebody is planning on doing some traveling, and I want to caution within the United States, we'll talk about international in a second, because there's extremely little international coverage. Medicare is a U.S. plan within the United States. Medicare does not cover you overseas. Some of these Medicare Advantage or Medicare supplements will have extremely limited overseas coverage, which will strictly be emergency. Okay. But you have so many different options. If you took, for example, you might take a Medicare Advantage PPO, where I travel up to Connecticut. Well, if I get sick in Connecticut and I'm on a PPO, I could call up my carrier, find out who is a local doctor in Connecticut or in the plan, and actually pay an in-network copay in another state. So that's a big advantage of PPOs. HMOs do not work that way. On an HMO, you strictly would have to go to a doctor in network. If you're traveling out of the area, the only way it'll cover you is an emergency situation. And emergency situations are covered. So whether you're on an HMO or a PPO, emergency is always covered. What's not covered is just going to see the regular doctor, just do this, that, or the other. But emergencies are.
All right. I'm so glad you clarified the difference between the PPO and the HMO models, because a lot of people, don't fully understand them. Those terms get thrown around so much. So I want to go
Let me follow up, Jonathan, if you don't mind, let me follow up real quick. PPO really represents freedom. HMO is generally going to represent dollar value. Okay. And HMO, you're going to see lower copays at the specialist. You're going to see lower copays in the hospital. You're going to see lower maximum out of pockets. You're going to see, you may not have a deductible on your medications on your HMO plan, where your PPO plan does have a deductible. So HMO does have a place, and I have quite a few clients that are on HMOs. Remember, there's not a premium involved whether it's an HMO or PPO, but the HMO had the right doctors, had the right hospital, and it had the right coverage at the right price. So that's where the HMO comes in. PPO is really more about freedom. If I have a PPO and I want to go see a specialist, I can just call the doctor, make an appointment, and go see them. On an HMO, it doesn't work that way. On an HMO, I need to call the primary care, go see my primary care specialist, and hope they will refer me to a specialist. They may or may not do that. With a PPO, it's automatic. You don't go through Dr. A to get to Dr. B. You just call the specialist and go see them. The other advantage of the PPO is the out-of-network benefits. An HMO, I've got to see a doctor in the network in order for my insurance to pay. If I go out of network, it's all coming out of my pocket. With a PPO, you can go out of network, but you're generally going to pay a higher copay. So, for example, if you had a $35 specialist copay in network, you might pay $70 for that specialist copay out of network, something like that. And PPOs, as I mentioned earlier, work much better for those who travel, because you're going to have just some regular PPO type coverage. And here in our area, we have a lot of people that might be down here, 7-8 months of the year, and they spend the rest of the time up in Ohio or New Hampshire or somewhere up north. And the PPO works real well for them. For those folks, we would look at a PPO, or a Medicare supplement might be an option. But for those who travel or out of the area a good bit, I don't think HMO is really their best bet.
Thanks for watching part 5 of our Medicare series. In part 6 of our Medicare series, we'll be answering, what does Medicare cost? Don't miss it. Follow us for more Medicare insights.